Department of Shoulder and Elbow Surgery, located here at the Charité University Hospital in Berlin, is part of the Center for Musculoskeletal Surgery. We roughly perform 1,200 shoulder and elbow procedures per year, including all kinds of modern arthroscopic, respectively minimal invasive techniques, but also acute fracture treatment as well as primary and revision joint replacement surgeries. Consultations of our patients takes place in the outpatient clinics. One is located at the Virchow Hospital, another one is located at Campus Charité Mitte. In addition, our patients with shoulder and elbow problems can contact us via the Clinique Sanssouci located at Kurfürstendamm, and in particular for athletes or patients with sports injuries, we provide outpatient consultation at the Department of Sports Medicine located at Charité Mitte.
One main challenge of our daily clinical work is the repair of rotator cuff tendon defects around the shoulder, and many of our operating techniques have been developed or improved in our own labs with regard to biological and biomechanical improvements.
Acromioclavicular joint instabilities play a major role in our daily clinical practice. During the last 10 years, we were able to develop surgical techniques that allow a minimal invasive and highly stable treatment of these injuries. Thereby, we can reduce the rate of complications and secondary surgery of open techniques.
Elbow injuries is the second clinical focus in our department. We cover acute traumatic injuries as well as degenerative pathologies. This includes the non-operative treatment as well as minimal invasive techniques, fracture treatment and endoprosthetic replacement.
In our department, we deal with a lot of patients who have a chronic instability of the shoulder joint, and the problem with chronic unstable shoulders is sometimes bone loss at the anterior glenoid. And for those complex conditions, we have developed a minimal invasive technique where we harvest a bone block from the iliac crest that we transplant to the shoulder joint, thereby recreating the anatomy and stability of the joint itself. We are a very young team, including residents, medical students and researchers who meet regularly in order to discuss basic science and clinical projects in the field of shoulder and elbow surgery.
As part of a global research community, we share the development of new surgical techniques and treatment strategies with experts from all over the world during congresses, workshops and instructional courses.
There it's a little bit different. There it starts after 60, then you can have the likelihood that you have an asymptomatic tear.
Ulna is a group of fibers which connect the supraspinous and subscap.
All of our clinical work, research and teaching contributes to the joint international effort to provide the highest quality and efficient medical care to our patients.